Well, Tyson Foods is dropping CVS as its pharmacy benefit manager today, sending another signal to pharmacy industry giants that maybe we could see further changes on the horizon. It's the second Fortune 100 company to drop CVS in the last year. And the food producer has switched to a much smaller outfit called Rightway, which guarantees 15% savings on pharmacy costs. The CEO of Rightway, Jordan Feldman, joins us now, along with our senior health care reporter, Anjali Kamlani. Jordan, thanks so much for being here. So what makes your model any different than the PBMs that are already out there, and how do you get that 15% savings?
Thanks for having me. If you look at the traditional PBM model, they're essentially on a taxi meter approach. The more money that members spend on drugs and the higher cost drugs that are dispensed, the more money they make. They utilize rebates, they utilize spread pricing. And because they have so much financial misalignment, the member experience is essentially non-existent. They have no incentive, no infrastructure, no technology to truly engage the member. And what that's created is double-digit compounding increases in pharmacy costs over the last decade. Now, what Rightway saw was an opportunity to really transform that member experience, to take the pharmacy benefit and financially align the model such that there's no spread pricing and no rebates, but really focus on the utilization piece of pharmacy benefits. How do we support? How do we guide? How do we advocate? How do we generate technology to help members understand cost of drugs and use all of that support that we really call a pharmacist and the family approach to help impact the trend and cost associated with the pharmacy benefit?
Jordan, Anjali here. I wonder, we're looking at this in a time where there's definitely been discussion about the changes needed in PBM. You see that in Congress. You see that in the general discussion with the payers. I actually had a conversation with the California Blue Shield CEO, who was one of the first to start this last year with their dropping of CVS. But they did keep them for specialty benefits. But there is something to be said about the conversation happening. He had this to say about what the expectation should be.
Our mission, I think, drives us to try to make the system better. What I would love to see from payers, because we set the rules of the system, I would love to see us change the rules of the system so that they facilitate that kind of innovation and consumer focus. So for example, that would include bringing healthcare into the digital age, retiring fax machines.
Of course, the fax machine being a different issue altogether, but I'm sure you could appreciate the idea that there needs to be movement here. I wonder what your thoughts are on that and what can be done and who really needs to be taking on that burden.
Look, the pharmacy benefit space is at an inflection point. They built a model that essentially traps margin and profits within the supply chain. And it's not working for employees and it's not working for their plan sponsors. So what we need to introduce to the pharmacy benefit is a financially aligned model. You can't have a PBM that makes more money when you spend more money and more drugs are dispensed. And I think, as Paul alluded to, the entirety of this innovation needs to be with the member at its core. If we're really going to transform and innovate around the pharmacy benefit, it's not just the price of the thing. We certainly need to work on that. We need to have transparency, but it's about the utilization. We have expensive brand name drugs. We have specialty drugs that offer biosimilars, that offer preferred brands, that offer generic drugs. And we need to be able to support and educate that member such that they know about these alternatives, such that they can pull up an app, as Paul alluded to, in a modern, consumer-driven way, where they could see the universe of options about what drug they're on, why they're on it, how much it costs, what the alternatives are. And if we can introduce that consumerism to the pharmacy benefits landscape, we can start to change that whole cost dynamic that's non-existent from the traditional PBMs today.
Jordan, I mean, Anjali's the expert here on healthcare, but every time I talk about pharmacy benefit managers, I don't just wonder why it should be done differently, but why they exist at all, right? There's no other industry that does this, where there's an actual separate entity that does the negotiation for product. And I get it, pharmaceuticals are complicated, but other stuff's complicated too. Why does this even need to exist?
So you have drug manufacturers and you have plan sponsors. And PBMs looked at that equation and said, we'll sit in between these two, the classic middleman infrastructure. They abuse this privileged position. They looked at that and said, how can we obfuscate the entirety of the marketplace such that we're the only ones that accrue the benefit and the profitability within this equation. So I would argue that the PBMs kind of sit within that classic middleman structure, but they've taken that for granted and they've done nothing to improve cost, to improve experience, to improve outcomes. Now, unless you're going to have drug manufacturers contract directly with plan sponsors and employers, you're going to need something that sits in between those two entities. So the way Rightway looked at that and said, this is just a classic technology company. This is a service that we need to provide between the drug manufacturers and the plan sponsors, but that doesn't earn us the right to make more money. That doesn't earn us the right to take a little bit of a rebate here and a spread price on the network and do all of this stuff that they've historically done to make more money. So we've introduced the PBM in a new structure that's essentially a technology company. We take an admin fee. You pay us on a per member per month fixed fee basis. We don't make more money when more drugs are dispensed. All we're doing is facilitating the pharmacy benefit such that members at Tyson and other employers that we work with can get their prescription drugs at a retail pharmacy setting, a mail pharmacy setting, a specialty pharmacy setting. So it's still a very important service, similar to how health plans provide that infrastructure that sits between providers and plan sponsors, but they've abused it. They've used that to make more money, and we're completely changing that dynamic and equation.
That flat fee being a very popular strategy right now. We've seen it with Cost Plus Drugs, which I know you have a partnership with. I wonder now, when you're looking at broader the picture of how this PBM strategy plays in a world where mail order and Lilly Direct exist, is there a world where we might not necessarily see the value or the need maybe for PBMs in the future?
So there's a lot of innovation within the pharmacy benefit space. We love that. We were the first PBM partner to Mark Cuban Cost Plus Drugs. As innovation comes to the market, we want to harness it. We don't have channel conflicts. We don't own our own mail order. We don't own our own specialty facilities. We don't own our own retail settings. So we want to harness all of this innovation, all of this technology that's coming into the space and say, how can we bring that to the member? How can we stitch it and harmonize it together such that it accrues to the benefit of the member? The way the traditional PBM model works is they own all their own assets. They fill all their own factories, and it's to no one's benefit but their own. So, we look at all of these opportunities and all of this innovation that's coming to the pharmacy benefit space, like the amazing work Mark Cuban and his team are doing, and say, we're going to bring that to members in a way that no one else is doing.
Jordan, let's keep in touch as you perhaps sign up some more big customers. Interesting stuff. And thanks also to our Anjali Kamlani. Thanks.